Thank you. Sarah, reflections?
Crikey, I'm not quite sure how to follow that because it was so eloquent. And I mean, I think, unfortunately, I wasn't able to be here yesterday, but from what I've been able to experience as part of the sessions today, I think we have really preconceived ideas about what mental health support, mental health treatment looks like, and the people who deliver that and what they look like. And I think what we've heard time and again today is that there's a whole other range of different therapeutic interventions that are just as valid, just as valuable. And, you know, we need to challenge our preconceptions across all organisations and think about how we can better work in partnership to really centre, I think, the kind of message, and hearing the young people speak over at the City Art Gallery earlier as well. It's that connection. It's about something that feels genuine, authentic, somebody who's actually there as a trusted individual, who's going to be with you on that journey, who's not going to shut you off at the end of a session time or when you've come to the end of a block of treatment sessions. It's about that ongoing relationship, that ongoing narrative, and being alongside and delivering care and support in a way that is engagement driven, that's centred around the interest and values of young people. And I think that there's so much that we can learn just in what we do on a day-to-day basis in mental health services, but also so much that we can learn in terms of how we can work beyond our organisational barriers to support children and young people with their emotional wellbeing and mental health.
And from the NHS's point of view, obviously, you know, the NHS has a lot of money, but it will obviously want to spend it very, very wisely. And for people who work in the arts world and have this as an area of interest, do you have any tips or things that they should be thinking about when they're dealing with the NHS for the first time, trying to work with them in a positive way? What do you look for? What do your colleagues in the NHS look for?
First to say, I wish we had a lot more money. I think that critical thing around the evidence base is, you know, we are an organisation, we talk about, you know, that kind of runs as a thread through everything you'll see. So I think it's really important that we're having these conversations about how do we put the proof behind what we all believe to be really the kind of the value in the concept, the kind of intrinsic value in this. And I think that's why it's really interesting. I've heard a lot of talk about, you know, organisations working, drawing down funding from NIHR, and you know, I think being able to work in partnership with that. I'm really inspired. I mentioned it a little bit this morning about those partnerships between the NHS. Because I think that, you know, there's a huge amount of value in working in collaboration, not least, you know, being able to leverage the investment of the NHS to be able to bring on other funding partners. I think that the NHS pound goes a long way in terms of joint funding. But I think that there's that real kind of power in that relationship, and I'm seeing it in lots of the services that we go out and see around the country, where you've got kind of clinical practitioners embedded alongside so that they can provide clinical oversight, a safe space for staff to feel contained and feel confident that the work that they're doing is safe, that they're not doing harm. And I think having a space as well, because we all need that space to be able to kind of process what we're working through as individuals, and clinicians working alongside, I think, can provide that. They can also provide that swift access into support where, you know, you're worried about a child's need deteriorating. But I think that that's what I'd really like to see more of. A, the evidence base, but B, that partnership working between the creative sector and the NHS.
Thank you. Guy?
Well, I suppose for me, apart from wanting now to move to Manchester, it's been an incredibly inspiring day. But I think really for me, it's the energy that I'm going to take away from listening to all the performing, to seeing all the performance that's been happening over the past few days. It's the, as I say, the energy, but it's also the connection, and I think what's really vital for me is taking that step back to reflect and also to listen. And there was a really powerful film last night about walking in the young people's footprints and steps. And for me, that really kind of rung a chord, because it, you know, I think we need to make that time and space to listen more. Certainly within the NHS and within hospitals, patient stories are so vital. We talk about evidence, but actually patient stories are data with soul, and I think it's really worth remembering that.
And you're based in a hospital. I walk past your hospital and I go into our London office every day. You know, and it's a big hospital, and you've made art quite central to that. And what's it like when clinicians or people who come from outside our world actually get to meet an artist for the first time and work with them? What's that like, and how does it spark off in a good way or a bad way?
Well, I think people are surprised first and foremost that they see there's an artist within a hospital, and I think that's one of the great things about art, is that it's there to agitate, it's there to ask those difficult questions, to shine a light on things that haven't necessarily been spoken about before. And I've worked with artists to ask those difficult questions, particularly around things like health inequality and access to care. So I think artists really enable that questioning to happen in a kind of honest and frank way, whereas clinicians maybe don't get to ask those questions. So I know that clinicians really value those interactions, but also from the perspective of their own kind of mental health as well. We have a big project for our staff wellbeing, and the creative offer that we offer is really, really important for our staff and staying resilient and strong and staying working and well within the workforce.
Thank you. Rod?
Wow. I think, I'm lucky enough to work and see young people and see their work most days at work, and that is most days. I think it's that sharing of vulnerability, that art does, and the strength it is to be vulnerable and to work alongside young people. And I think I'm just always so impressed with how artists do that and how our young people use it to be vulnerable, and we support them to be okay within that. And I think there's no greater kind of human response to life itself, really. So I feel very grateful to see the work that our young people create, and art in general, it's a life force for me. Everything I do is around art. So I think walking alongside those young people and them sharing their messages and their use of art, I think has been really really emotional.
You know, from our point of view at the Arts Council, we're very proud to invest in 42nd Street, and I know the Baring Foundation also to do a lot of work around mental health for young people as well. What strikes me from what you've done in the way you've curated these last couple of days is absolutely put young people's voices at the centre of this. And do you think that their voices are heard enough in this sort of world, or do we need to do something different?
Part of my job is to support young people to use creativity in whatever way they wish, and that is the rich creative process is hugely rich and hugely open for different interpretations and uses. My other job is to do a bit of a PR job for young people, because so often they're looked at a lens through behaviour or academicalisation, or they're looked at, we're almost quite often feared for and feared by young people. And I've felt that all my career working with young people is young people quite often struggling with how they're represented and how they're seen in society. And you could see that the asking for mental health support is a huge message from young people, saying what you expect of me, what you're putting me through does not feel right. And I think the arts has acts in a way that adds that humanity that we need, and we all need it. We all know how hugely important our teenage years are. They affect us for life, and we need to validate that for our young people now that their teenage years' lives are hugely important, and we need to give them the freedom to work out what they're doing, how they're going to manage the stuff that we've given to them, the stuff we've handed to them, the huge pressures we've handed to them. Art is the way. I worked in so many different organisations supporting young people as a carer, children's rights worker, youth voice stuff, and I came to 42nd Street and I went straight into the arts. I said, the arts do this. Whatever I'm trying to support a young person to do, to have fun, to process, to have a voice, to work things out, to be energetic, whatever, the arts do it. And also, we're better off in the arts for that as well, because we're getting these stories from young people that absolutely at the core are creating work that they need to work, and society needs to work, needs to see that. I think it's quite often a very individualistic pieces of work, but that in itself is universal. We all know that, don't we? We all know that the work of individual artists, we see things in it, it's a communication tool. So yeah, this is where I sit after working with hundreds and hundreds of young people in different situations. This is what can really make a difference for me.
Thank you. Gemma?
Yeah, I think the last 2 days have just been incredibly inspiring. I remember last January, and I